acute respiratory distress syndrome, ARDS. That is the topic for discussion today. What is ARDS? Acute respiratory distress syndrome or ARDS is a sudden progressive form of respiratory failure characterized by severe dyspnea, refractory hypoxemia, and diffuse bilateral infiltrates. This is a sudden progressive form of respiratory failure. Okay, it's not something chronic, but acute respiratory distress syndrome or ARDS is a sudden progressive form of respiratory failure. It follows acute and massive lung injury that results from a variety of clinical states often occurring in previously healthy people. The syndrome was first described in 1967 and has been referred to by several terms including shock lung, wet lung, post-traumatic lung, congestive atelectasis, capillary leak syndrome, and adult hyaline membrane disease. These are other terms used for ARDS. What are the causes of ARDS? It can be direct lung injury. For direct lung injury, common causes are aspiration of gastric contents or other substances and viral or bacterial pneumonia. Aspiration of gastric contents or other substances can happen. Gastric contents may get aspirated during in case of unconscious patients or patients who has no gag reflex. In such cases, aspiration of gastric contents can occur, and other substance like in case of poisoning and all, if vomiting is induced, in that case that poisonous substance may get aspirated into the lung. All this can lead to direct lung injury. Same way, viral or bacterial infection or bacterial pneumonia also can cause ARDS. Like example, in COVID-19, first we thought the patient is going to complications or to a critical state because of ARDS. Viral infections can lead to viral pneumonia can lead to ARDS, and same way bacterial infections also. Less common causes are chest trauma, embolism. Embolism may be resulting from fat, air, or amniotic fluid. Then inhalation of toxic substances, near drowning, oxygen toxicity, and radiation pneumonitis. These are less common causes. Then indirect lung injury. First we have seen direct lung injury, and now it is indirect lung injury. The common causes are sepsis and severe traumatic injury. Sepsis, septicemia. In septicemia, that can lead to ARDS, and severe traumatic injury, which affects multi-organ, also can lead to ARDS. Less common causes are acute pancreatitis, anaphylaxis, prolonged cardiopulmonary bypass surgery, disseminated intravascular coagulation, multiple blood transfusions, narcotic drug overdose, like in case of heroin overdose, then non-pulmonary systemic diseases, severe head injury, and shock. These are less common causes of ARDS.